Hey everyone, welcome back to our channel. If you're a healthcare professional or a student looking to master clinical documentation, this video is for you. Today, we're summarizing the Guide to Clinical Documentation, 3rd edition, in just 8 minutes. Before we dive in, make sure to subscribe to our channel, hit the like button, and visit www.bookread.xyz, where you'll find top ebooks in medicine, business, and much more to help you on your professional journey. Summary of Guide to Clinical Documentation, 3rd edition. This book is a must-read for anyone involved in healthcare. It provides practical advice and strategies to write clear, accurate, and effective clinical notes, whether you're in medicine, nursing, or allied health fields. 1. Why clinical documentation is important. The book starts by explaining the critical role of clinical documentation in healthcare. It's not just a record of patient care, but a legal document that impacts patient safety, communication among healthcare providers, and even reimbursement processes. The key takeaway: accurate documentation is essential for ensuring high-quality care and preventing medical errors. 2. Foundations of good documentation. The guide lays down 4 key principles that form the foundation of good clinical documentation. Accuracy. Document exactly what you observe and do, without guessing or leaving out important details. Completeness. Include everything relevant to the patient's condition and treatment. Objectivity. Stick to the facts, without injecting personal opinions or assumptions. Timeliness. Don't delay. Document patient care as soon as possible after each interaction. These principles ensure that your notes are both useful in patient care and legally sound. 3. Electronic Health Records, EHRs. Today, electronic health records, EHRs, are the standard in clinical documentation, and this book offers advice on how to navigate them effectively. It covers how to structure your entries in an EHR for clarity and accessibility, the importance of avoiding over-reliance on pre-filled templates, which can make your notes appear generic, ensuring confidentiality and adherence to HIPAA rules when working with digital records. EHRs have transformed the way healthcare professionals document, and this section helps you make the most of them while avoiding common pitfalls. 4. Types of documentation. One of the key chapters breaks down different types of clinical documentation. SOAP notes: subjective, objective, assessment, plan, a structured way of recording patient interactions to ensure completeness. Admission and discharge notes: detailed documentation at the start and end of a patient's stay. Progress notes: tracking a patient's response to treatment over time. The book emphasizes how these different types of notes should be crafted to provide a clear, complete picture of the patient's journey through care. 5. Legal and ethical considerations. Documentation is not just about medical care, it's also a legal document. The book covers the importance of documenting truthfully and avoiding alterations or late entries without proper notation. Legal protection. Your documentation may be scrutinized in a court of law, so it needs to be precise, thorough, and defensible. Ethical responsibilities, such as avoiding falsification of records or writing notes to influence outcomes like insurance claims. Understanding these legal and ethical dimensions helps protect you and your patients. 6. Common pitfalls to avoid. This book does a great job of pointing out common mistakes that healthcare providers make in their documentation. These include vague language. Avoid phrases like "appears to be better." Instead, document specific changes you observe in the patient's condition. Failure to document patient noncompliance. Always note if a patient refuses a treatment or doesn't follow medical advice. Relying too much on templates. While templates save time, they can result in documentation that doesn't fully reflect the patient's condition or care. The book provides examples of bad documentation practices and how to avoid them, ensuring you don't fall into these common traps. 7. Documentation for special populations. The Guide to Clinical Documentation also dedicates sections to documenting care for specific populations. Pediatric patients. Documenting developmental milestones and family involvement is crucial. Geriatric patients. Focus on cognitive decline and multidisciplinary care. Behavioral health. Properly documenting mental health assessments and treatment plans is essential, particularly for tracking risk factors. This ensures you can tailor your documentation to the needs of different patient populations. 8. Looking ahead. The future of documentation. Finally, the book touches on the future of clinical documentation. Technologies like artificial intelligence and voice-to-text systems are already starting to change the landscape. The book encourages professionals to stay adaptable and always focus on improving the quality of their documentation, regardless of technological advancements. Conclusion. To wrap it up, the Guide to Clinical Documentation, 3rd edition, is an essential tool for anyone in healthcare who wants to improve their documentation skills. It's not just about meeting legal requirements. Good documentation can improve patient outcomes and enhance communication within the care team. Whether you're a student or a seasoned professional, this book is a valuable resource.
And before we go, don't forget to subscribe, hit the like button, and check out www.bookread.xyz for top-quality ebooks, including those in medicine, business, and much more. Thanks for watching, and see you in the next video.